today is Ameritas with Abbi Krull. Um, so I'm not going to waste a lot of your time on all the general stuff like housekeeping. I think everybody's name I see on the list knows to put questions in the chat box, and you'll be okay. One of the biggest things that we really want to talk about coming up is the Broker Expo, or the Cornerstone Broker Expo is back again in Cleveland, and we've added that second location in Bowling Green. And I know many of you are not in Northern Ohio, but if you wait until next year, I'm hoping to come to Columbus and Cincinnati for all of the rest of you. It's a pretty, we couldn't do all 4 locations like Cornerstone Senior Marketing does. It's just too costly with the number of vendors I can get. So I am going to, while Abby's presenting, going to put a link in the chat so that you can go out there and get it. I think you should have seen lots of emails by now and invitations. So just click on the QR code and register if you haven't already. So I think, Abby, I'm going to stop and I'm going to let you share.
Okay,
We didn't get a chance to test. All right,
perfect.
let me stop sharing. Okay, you should be able to share yours.
Okay. Just not letting me, it says to share, ask the organizer to make you the presenter.
I thought I already did that. I'll do it again. There you go. You are now.
There we go. Yeah, that's working. Okay, good morning, everyone. Hope everyone's doing well. Let's see all this gets up. Which screen that is. Okay. See how that is working. Oop. All right, it's still on. Sorry, 1 second. Okay, we should be good to go now. Good
Yay.
morning. Thank you guys so much for having me on this morning. I'm excited to kind of give you a rundown on our products. We don't have any changes right now, but keep in mind, apparently there are changes coming later this year. I do not know what those are, or else I would share them. But I have heard confirmation that there will be changes coming. So I think we can all agree that we hope that it'll be even better plans and all that stuff. But for now, I'm going to go through our current portfolio. These will be up, available until those new plans are being launched and released, and we'll make sure you are all aware of that start date. But for now, this is what we have available, and excited to kind of run through it. All right. Ameritas in the news. So we've got some good compliments going on in the news. We've got, best dental insurance companies in 2024 on CNN, Forbes Advisor, best dental insurance for seniors of 2024. There's a lot of good talk about our products in the news, which is great. And people seem to have a wonderful experience, which is our goal. We want robust plans that are easy for you all and our members. And, I think most people feel that we accomplish that, which is great. See, the importance of dental and vision. So basically, why sell dental and vision? Why should this interest you guys? Keep in mind that a lot of health will keep, overall health good. So 60% of gum disease is associated with nearly 60 other health problems. Tooth decay affects 90% of adults aged 20 to 64. An eye exam, I can identify early signs of more than 270 diseases. And 20% vision provider detected a non-eye related health issue. So if you're going and getting your preventative care on your dental and vision, it can help you with medical costs. And we've been researching a big correlation between the two. So not only is it just, healthy for you to go get your cleanings and you don't want to have bad breath, but it can really relate to your overall health, and it is important. For example, I'm actually pregnant right now, and Ameritas offers on our dental plan like a maternity benefit. And there's a lot of correlation between gum disease and, preterm labor. So it's actually really important to get I think it's like 50% of, pregnant women get affected by some type of gum disease. So there's, again, a lot of facts that correlate together and on that overall health. To get into our plans, so the Prime Star Light plan, this is our greatest value for individuals who want to maintain a good oral health. I kind of like to say that this plan is for those who are like, I think I have healthy teeth. I want dental insurance because I want to get my cleanings and I want them to be covered. But, I still want to keep the cost down of my plan. So this is after year one, the maximum jumps to $1,500. And it is also a growing benefit in coinsurance. So day one, you start at a certain percentage for coinsurance and maximum, and then after year one, it jumps. So you're going to get your best benefit after year one. The deductible is $0 for preventative care, and then $50 for type 2 and type 3. And then preventative plus is included. This is important to note. So even though the maximum is $1,500, all preventative care does not count towards the maximum. So your exams and cleanings do not count towards the maximum. So you could argue that that's an extra couple $100 towards that maximum. So I look at it more like, the maximum really is like $1,750, again, depending on how much your dentist is charging and whatnot. But it's really nice for people that preventative care does not count towards the maximum. So they have the maximum for more, basic and major services come up. There's no waiting periods. So it is, next day effective date, and then no waiting periods. But again, it is a growing benefit. So if you were to hop on the plan the next day, wanted to, get a crown, and you're going out of network, that coinsurance would only be 5%. So just things to keep in mind. You still get some type of benefit, and there is no waiting period, but it is a growing benefit. So important to keep in mind. The Boost plan, this is kind of a next level up. We like to say this is a balanced family plan that includes child ortho. So if someone's wanting child ortho, this is the plan. This is the only plan that has ortho. It's going to be what they want to get signed up for. This one has up to a $2,000 maximum after year one. Preventative Plus is also included on this plan. So again, you could argue it's actually richer than a $2,000 maximum. Same deductible, $50 on type 2 and type 3, waived for type 1. And then this is also a growing benefit on the coinsurance from day one after year one. Same for child ortho. So that day one, you're going to be at 15%, but then after year one, you're at 50%. The jump in coinsurance, I honestly feel like you guys can use when selling the product, because you can say, hey, you might not need something right now, but what if something comes up next year? You want to have that full coverage. So try to use that to your advantage when you're trying to sell people on this product, and kind of change that mindset rather than, oh, well, I don't get the full benefit. It's like, especially if they're healthy and they have a healthy mouth right now, then that's okay. But, point of insurance, you want to be prepared when something does come up. So Getting them signed up now can just ensure that they get that full benefit, and be on the plan for at least a year. Implants are included on type 3 on this plan, and teeth whitening. Teeth whitening, a lot of people love. So teeth whitening is included on this plan. Again, just the pretty balanced family plan, a little level up from the prior plan that we just discussed, but not our most robust plan. So getting into our most robust plans, the complete plan has still not been approved in Ohio. And it's funny because we're getting ready to like change plans anyways. So I guess it doesn't really matter as much as at this point. But right now, complete plan is in all of the surrounding states outside of Ohio. So you absolutely may still very well have people that this plan is available for. This plan has the highest maximum. It goes up to $3,000 after year one. Preventative Plus is included. So again, you could argue it's like $3,300 or maybe even more, depending how expensive that dentist is that you're going to. $50 deductible, again, waive type 1. So same there on all the plans. Growing benefit on the co-insurance from day one after year one. And this plan includes a hearing exam benefit. It's basically, or a hearing aid and exam benefit. So every year they get $75 for a hearing exam, and then they get a hearing aid benefit per ear. After year 2, this goes up to $400 per ear. So definitely going to get your best benefit after year 2 for this. Some people feel like they can't wait. They want to get it now. Or some people will be like, oh, sweet, I'll get my Costco hearing aids now, and then in 2 years, I'll get a fresh set, even though they should last a little bit longer than that. Sometimes people like to have multiple hearing aid sets for whatever reason, but it's really nice to have that benefit. This is kind of targeted towards that older generation that is more in need for hearing aid benefit, more need for that higher maximum, has more health problems coming up in the mouth. Implants are also covered on type 3, but you're really paying for that high maximum. And, if they need a crown the next day, if they go in network, 20% co-insurance is still pretty strong, still really good benefit. And sometimes, depending on how much work they need done, they still might even hit that maximum, even with that 20% co-insurance. So this could be a really great plan for people that kind of need that immediate care, especially depending on what they're getting done. So this is the most robust plan that's in Ohio. This plan is still very, very robust, and it still offers that hearing aid benefit. Just a couple differences here. So the maximum goes up to $2,500, but again, that Preventative Plus is still included. So you could argue that that maximum actually is close to that $3,000, because again, that preventative care is not being counted towards the maximum. So very, very rich benefits still. On our group plans, I think the average is still like $1,000 or $1,500 to have on a dental plan. And we only have like 8% of our members hitting their maximum on group plans for only $1,000 or $1,500. So for most people, this is going to be, a very wonderful, rich benefit for people, and still, very robust. So same deductible, $50 on type 2 and type 3. This has a growing benefit on co-insurance from day one and after year one, except for there's not the in and out of network differences. So some people actually might like having this plan more than the complete plan because they're not getting as dinged, I guess you could say, for going out of network. So some people, actually don't want to see this plan go. So it's just, we've got different opinions on the different plans and all that stuff. But if you like this plan, take advantage of it now. I don't know what to expect for the changes coming, but if you like these
So
plans, try to get
Abby,
them enrolled now. Yeah,
here's a question. So a member, a broker has a member on any one of these plans. A new, more robust plan comes out. Will they get creditable coverage to join that new plan with no waiting period?
they will not, unfortunately.
Oh, okay.
Yeah, they will not. So that, and I think the thought there is just the risk of like, okay, if they're jumping from a lower plan to a higher plan, like there's on our plans, there must be a need. Now, if they're coming from a different carrier or a group plan, yes, we will waive that
Okay.
waiting period. I guess you could argue that it is. But yeah, jumping from one plan to the next is a little bit more tricky, unfortunately. At least now, again, that could change too. That very well could change. So for now, that is not possible, but in the
Okay.
future,
I
it could be.
understand.
So, yeah,
Ask, please.
yeah,
Because you're
I
keeping
will.
you're keeping a member, right? I mean, it just
Yeah,
gets it's additional years for them. So
for sure. And even if
yeah,
there was some type of regulation, like, okay, maybe
even
they've
if it's
had to have
less
been on the plan for 12, yeah, for 12 months or something.
or
So
shorten the
I
waiting
agree.
period.
Yeah, yeah, absolutely. I'll give that feedback for sure.
There you go. Thanks.
Ameritas Dental Network. So dental networks are a big, conversation right now nationally. Ours is one of the largest in the nation, which is great. So if you have a member that is a snowbird, is down in Florida half the year, and they want to have access to the same network, this is a great plan for them. It's the same network, all 50 states. We actually even have some in Mexico. If someone's, in Europe and there's an emergency, they can call into Ameritas. We can actually help them find a provider even in Europe. Um, that I don't know if they're technically like contracted as being in network with. We have like contacts that we work with, overseas. So large, robust network with very deep discounts. So how if someone's like, well, mad that their dentist is not in network with us, I kind of like to word it like this. I like to say, these insurance carriers have networks not to hurt the member. It's truly not to hurt the member, even though I think sometimes they think it is. It's actually to benefit the member to have somewhere to go to get a discount if they're needing to watch the cost of things. So when you're going in network, that's really what that is. It's a discount, and it can be nearly 25 to 50%. You know, even very high here in Ohio. I would say probably close to 40%. So if you're getting 3 crowns or something, that can save thousands of dollars by going in network. So you do not have to go in network on any of our plans. They are PPO plans, and we try to make that out of network experience still very great. We work with out of network providers directly. They should be able to bill us directly. I know every once in a while there's a stubborn, old school provider that will not submit claims to, any, honestly, any network or any carrier. So that comes up very rarely, but for the most part, every, dentist, even out of network, know how to submit the claim to us, and they should, and we're happy to call them too. Um, so that's kind of how I like to word it is maybe go get your preventative care to your current, family friend dentist. But if you have a big major service that comes up, just consider going in network because it's really just savings to the member. Obviously it helps with claims as well, but it is savings to the member. So very robust network. A little bit more about the credit for prior coverage that we were just talking about. So it's available when replacing a fully insured group plan or individual dental plan. Um, The gap in coverage must be no more than 60 days from the Ameritas plan effective date. Prior coverage had to have been in effect for at least 12 months. We need the carrier name, policy number, the term date while they're enrolling. And there's a couple states it's not available to. And basically what this does is that it lets you jump to year 2 coinsurance, not the maximum. I know a lot of people wish it was the maximum gets to jump up, but it's just the coinsurance. So again, that can still make a big difference for people, but it's not the maximum. It's just the coinsurance. So just something else to keep in mind. So standalone dental versus Medicare Advantage. With standalone dental, you get the robust, benefit coverage with comprehensive care. You have national network access with extra savings values. Keep benefits even when changing medical plans. So you can keep these plans even when changing medical. And you can enroll 365 days a year, 24/7, whenever you want. So with Medicare Advantage, there's limited coverage, key benefit limitations, for example, implants, no network, so they don't get even just access to having a discount if they want it. And then limited enrollment window, which can disrupt the dental plan when changing the medical plan. We also have vision as well. I feel like we always focus so much on the dental, but we do have vision. We have 2 vision plans. We have a VSP plan and an IMED plan. So it's, that network choice, but then also a slight difference in plan design. The VSP plan is going to be a little bit more robust than the IMED plan. It's going to be a 12-12-12 frequency. So what that means is every 12 months you get an exam. Every 12 months you get lenses or contacts. Every 12 months you get new frames. So the frequency is, again, every 12 months. And then the frame allowance is up to $150. And then the deductible is a $10 for exam and $20 for lenses or frames. So rich plan. A lot of people like the VSP network. Got Costco, Sam's Club, VisionWorks, Walmart, Pearl Vision. And again, it kind of just depends where people would like to go. For the IMED plan, the frequencies are going to be 12, 24, 24. So that means that exam every 12 months, but then lenses or contacts every 24 months, frames every 24 months. On this plan, I like to suggest to people to do a lens and frames to get, a new set of glasses together, and then the next year do, I guess, every 12 months. And then they could do contacts. So I don't know. They try to pair it up, I think is the best way to do it, but it's not as rich as the VSP plan. For deductible, it's a little bit higher, $25 for exams, $25 for lenses, and then only $130 frame allowance. So a little less like rich of a plan, still a great benefit. It's going to be a cheaper premium too. And then some people love lens crafters, like their Target Optical, like they want the IMED network. It's a little bit more retail focused. It's truly just a choice on what the member likes more. So resources for you, quick quotes and easy enrollment. So our goal, again, is to make things as easy as possible for you guys. So there's no waiting periods. So immediate benefits for all services in most states. Next day benefits. So next day coverage or up to 90 days in the future, so that you can, if they don't want to start right now, they can go up to 90 days out. It's zip code rated, so it's not based on age or gender. And you have to be 18 and up. Quick quote. So you only have to answer 3 questions, no personal information to get those quotes, and to see what the pricing is going to be. So I was walking my father-in-law through quotes when, he retired, and some of these websites, like they ask for so much stuff like up front, and you just kind of want to see the pricing and the plans. So that's what we are able to provide with our website and our plans. Value added benefits. So we've got the ortho, implants, teeth whitening, hearing care, some extra enhancements that people really seem to enjoy. And then enrollment, we have the credit for prior coverage. only need, an electronic signature, and it's online enrollment. No social security number. We don't ask for the social to enroll. I know that's a big thing for people too. And then payment options, we have EFT or credit card, and then Ameritas pays primary, so no coordination of benefits. We've got a great site for agent marketing resources, sales tips, training videos, state-specific brochures, member material, social media ad templates. This site has a lot of really good for you guys, so highly recommend checking it out. Producer portal. So this is kind of where you can see your block of business, review new cases, set up EFT commission payments, view and download commission statements. You can order ID cards, email online access instructions to clients, and our find a provider link is quickly accessed through the producer portal. Automatic sales credit with your shopping link. So work with Cornerstone and Brad and Jeff to, get your individual shopping link. This is where the magic happens, as we like to say. It's the important piece of the puzzle. You can put this hyperlink on your LinkedIn, in your email, website. You can, do a QR code with it for printed material. So there's a lot that you can do, and it's again, we try to make it as easy as possible. There's additional savings on hearing exams and hearing aids with our plans. For anyone enrolled in dental or vision, members, can print these cards from their member portal. It's basically free consultation, $50 hearing exam. There's a couple other benefits with this. So you don't have to use this if you have the vision or if you have the hearing benefit. It's not a network hearing benefit, but this is just an additional resource. Same with prescription drug savings. This is no additional cost. It's available at 60,000 plus pharmacies and can just provide some additional savings. We have a new member app that came out last year. Kind of like, oh my gosh, 2024 finally came out with an app. But what matters is that we do have one, and it really has helped with the ID card conversation. When people have this app, they can go pull their ID card, see their EOBs, review processed claims, see where they're at with their deductible and their maximum, see their dental plan and like what they have. So this has been, really nice for a lot of members. That is what I have for you today. So that's what I have open to any questions that you guys might have.
Well, there are a few, Abby. I was waiting until the end because I didn't want to break your flow. But I think with that personal URL is a really great way, right? Abby said there's three things to write an application. Just think how easy it is to send your client to that URL, let them look up their dentist or all of their dentists, maybe if they have that much, and find the plan that works for them. And you don't touch it, but you get paid. So that's a
Yep.
really good thing. Abby, I liked your comment on don't wait. If you have or your clients have a young child whose teeth are already a little crooked, guess what? Start them a year early. Then they're going to get that whole 50% of orthodontia, $1,000 of coverage, or 2,000 of which the plan covers 1,000. So I think really great stuff. And the pricing on these plans, they're so simple. I think the basic vision is about 10, 11-ish dollars, depending on where you are. The higher the VSP one is like 13, 14 again, depending. So, just a few dollar difference. You get $20 more, you get a different network, sometimes richer. And their dental plans, the light is under $20. And then the other two plans, the complete and the boost, are low 30s and slightly mid to upper 30s. So you can't go wrong with the plans. It's actually the plan of everything you all sell. Ameritas is probably our number one sold plan by our individual brokers, our group brokers, and everybody else who contracts with us. So it's really simple, easy plan. So here's the questions. Um, is there a missing tooth clause on the plan, Abby? And I don't know. I'm guessing is if they can get a crown or an implant, we're in a place of where there's a missing tooth. I think that's what.
Yeah, I believe that there is. I think it's within, if it's been within the last 12 months, it's fine. But if someone had a missing tooth like from 5 years ago, that wouldn't be covered. So I
Okay.
think it has to be within the 12 months, but I will confirm that.
Okay. And let me know. And yeah, it was kind of if they can get a bridge or implant. And Jennifer, it would have to be. It seems like at least initially, within the past 12 months. But Abby's going to find out details, and Jeff and I will get back to you on that. All right. So these are all interrelated questions or statements. Um, since other companies have higher out-of-pocket limits, will you be adding higher options? And I think you said that answer is possibly, but can't say now. Um,
Yeah.
and
I wish I
yeah, I guess,
knew. I wish I
yeah,
knew.
right. I know, right? Um, why haven't they been approved in Ohio? Ohio Department of Insurance is tricky. Like I noticed a trend with hearing. There's only two carriers that allow or have a hearing benefit. So I'm thinking somebody in the Department of Insurance has a sibling or a cousin who owns a hearing center, and they don't want to affect their business because government is never corrupt. Oh God, I shouldn't even start that conversation. Um, how are
Yeah.
claims paid for out-of-network DD or dentists versus in-network? So paid direct? Is it reimbursement? Um, how is that, Abby?
So again, we do typically work directly with out-of-network providers. So they should submit the claim to us still, and then the provider or the member should work with the dentist on that payment. They shouldn't have to like pay us. So it can vary depending on the provider, but we will work with that out-of-network dentist directly, typically.
Yeah.
So in some ways, it's the exact same as if you were to go in network. You go, especially like your preventative care, you don't have to pay anything because your plan covers at 100%. Um, and you go on your way for both in network and out of network. Now, there are some out of network providers, and again, this is way more rare, especially nowadays, that they refuse to submit the claim for the member. So in that case, they might have to pay the dentist up front and then get reimbursed by us in the back end. But that is very rare. Very, very rare. And if your dentist is doing that, then it's really their doing, not ours. But again, very rare that that would happen.
Yeah. I hear it quite a bit with dentists where they don't accept any insurance. Why is
Mm-hmm.
that, you ask? Because they want to charge whatever they can. That's the reason they do it. They don't want to. They don't want to hire a person that has to do all kinds of claims. They just want to be a simple old dentist.
Yeah.
And I hear that more frequently than you would think. So I think the critical thing is to tell your clients, obviously, if they're using a network dentist, then there's no problem. But it's when they have that like periodontal doctor, or that's not it. There's another specialized dentist.
Endodontist.
Um,
Endod
yes, an endodontist. Thank you,
Yes.
Jeff.
I
You
know
must
all
have
of them.
had
I've
some
had all of that
endodontist.
done. I know them too well.
So
Yeah.
again, if they're going out of network, I think before your clients have the procedure, they should be asking, will they be able to bill to Ameritas, or be able to do the reimbursement part? So
Ameritas
that's
really
that.
shines with that. I've had really good success.
Yeah.
Yeah,
Yeah.
with that. I mean, that's and with our agents as well. That's what they really, um, value Emeritus for is
Mhm.
Yeah.
the breadth and their strength.
Yep.
Awesome. Yeah, that's what we
Simple
like
to
to
sell.
hear and our goal.
Yeah. I mean, next day coverage is also a pretty nice thing to have too.
Hmm.
Buy today, get it tomorrow. Nothing better. So, um, a good job on the app, Abby. That will help a lot of things. Surprised it took that long. I didn't realize that
Yeah.
until you brought it up.
Yeah.
But downloading the app just gives them more access, like any carrier. Um, they have everything at their fingertips rather than calling you and asking you for everything.
Yep. Exactly.
Uh, yes, you're correct. Gary comments they also have very low rate increases. I think they've been pennies or under $1 or two. Again, depending upon county, I guess. So or zip
Yeah.
code. So good. I think that's good. This could be one of the shortest trainings we've ever done. Are there any other questions? Congratulations to Abby for being an expectant mom. You'll see Abby at one of the expos at least if you're coming. Um, Jennifer, contact. I can't remember where you are, but let Jeff or I know whoever
She's
you
down in
regularly.
Cincinnati, so
There you go. Talk to Jeff. He'll get you that link.
yeah, shoot
It's
me an
super
email,
easy.
Jen, if you wouldn't mind, and then we'll get
Yeah.
the ball rolling today
Yep. Super
on
super
that.
simple. Yep. Good. So we have a positive
Really
thing
strong
already.
coverage.
Yeah.
This is our go-to option,
Yep.
Ameritas.
Love
Yeah,
to
we
hear
have
it.
others, but it's a struggle. I mean, when I look at the couple of other carriers that we have, it can fit on my hand. In Abby's, I need a ream of paper, or Ameritas, I need a ream of paper to look at that. So that's why it's simple, it's easy. That's why everybody who sells it sells it. So good. All right. I don't see a flurry of questions coming in. And I don't want to hold Abby because I know she has an upcoming meeting that she probably wants to prepare for. So if no one says anything more, I'm going to shut it down. Tell you to all have a great rest of the week. Enjoy the
Awesome.
mid to upper 70s when they get here on Friday because it's cold in Cleveland right now. We go back and forth. So yeah, anyway, it's nicer in Cincinnati. All right, everybody. Thank you very much. Have a great day. And we will talk to you again soon at
Thanks,
another
Abby.
training. All right. Thanks,
Bye,
Abby.
everybody.
We appreciate you. See you. Bye.